what's the role of the Secretary of HHS as far as recommendations of vaccine, and just discuss it a little bit further?
Well, the vaccine recommendations, Senator, are normally made through ACIP, which is the Advisory Committee of Immunization Practices, which is an outside consulting committee at CDC. There's another committee called VRBPAC, which is within FDA, that actually recommends whether the vaccines get licensed or not. And so that's where the recommendations come from. And you know what? Traditionally, they have not done evidence-based medicine. They only adopted evidence-based medicine about 12 years ago. And what we've said during our administration is we want to have safety studies prior to the licensure and recommendation of vaccines. Vaccines are the only medical product that is exempt from pre-licensing safety testing. So the only vaccine that has been tested in a full-blown placebo trial against an inert placebo was the COVID vaccine. The other 76 shots that children in this country receive between birth and 18 years old, none of them have been safety tested in pre-licensing studies against a placebo, which means we don't understand the risk profile for those products, and that's something that I intend to remedy.
So what he just said is not true. I don't know where he gets this number. About 12 years ago, we started doing evidence-based medicine for vaccine safety and efficacy testing, but we've been for decades doing various clinical trials, including randomized double-blind placebo-controlled trials, where we are literally randomizing participants to reduce bias, double-blinding, meaning the people getting the vaccine and those giving it don't know what they're actually getting. They either get the vaccine or they get a placebo that looks like the vaccine, but it's not real. And then they measure primary outcomes, such as whether they end up getting an infection or having severe disease, as an example. And for updated vaccines, we do active comparator trials where we're comparing groups that get the new vaccine versus the previous version to see if the newer one is more efficacious, more effective. And then we do post-marketing surveillance to see if vaccines have concerning side effects. And from time to time, the FDA will pull vaccines from the market, like the recent chikungunya vaccine that was recently removed due to some concerning side effects in older people. Now, you may not be aware of this, but in order for new vaccines to come out and have full recommendations from the CDC, the ACIP recommendations must be signed off by the CDC director. And there is no acting director at this time, so it is actually up to the Health and Human Services Secretary, RFK Jr., to sign off on new vaccine recommendations until Susan Minares is actually confirmed as CDC director.